here we're going to go over the examination for a type 1 gynecomastia patient. And as you can see with this patient, I've already have it marked out, and you can see where the breast tissue is. So what I've done is just felt where the breast tissue is, and it's limited to just being on the chest, which is a key distinguishing factor with a type 1. The breast tissue is not dropped below the pec muscle. The other important thing is how much does it weigh? Because when the weight of this breast tissue gets to be more than that of like a golf ball, it starts to put a very heavy burden on the skin, and it means that it might progress over time. So it's really kind of more important, the bigger it is, to actually take care of that. So the next thing that I look at is the pec muscle itself. So I've drawn it here, and in a type 1 patient, the pec muscle, the chest fold is going to be exactly where the pec muscle is. So they're one and the same. Now you could go to the type 2 exam and see how this starts to change with time. But for him, the chest fold is exactly the pec major muscle. So what I'm going to be doing, and the key thing with this procedure, is to make an incision that's going to go just from there to there. I'm going to keep it as tiny as I can. However, I do remove a sliver of skin to help with that deflation, because when the breast tissue gets removed, there's going to be a little deflation involved, and we want to tighten that skin. So then we go in, we'll remove that breast tissue, and the important thing with type 1 is that you've seen it. It literally just grows into the areola. And the important thing is to actually make sure that we get all the gland out, but we don't take too much of the dermis, because if we take too much of the dermis, it's going to thin it out and you end up getting some rippling. So that comes with experience. So without further ado, let's go ahead.